Today's a big day for a lot of reasons, Paul.
Yeah.
Not least of which, what has become a, hugely successful national effort to get people to, kick a very deadly habit once and for all. The Great American Smokeout has become really part of the national landscape. And, we're going to chat it up a little bit right now. Kevin McGirr is clinical professor in the School of Nursing. And he holds a master's science and a master's in public health. As I mentioned, clinical professor at the School of Nursing for the University of California, San Francisco. He's with us on the telephone right now. Thank you for being available, sir.
Good morning. Glad to be here.
We have seen some strides made here, right? The United States appears to be trending in the appropriate direction when we talk about smoking rates, aren't we?
Absolutely. We've done an incredible job in the area of public health over the last 40 or so years in decreasing the amount of smoking in the U.S. population by more than half.
Now,
That's good news.
Yes, indeed, it is good news. But that does mean that there's still about, 36 million Americans who are regular smokers.
That's correct. That's correct. And we find in that group of smokers that the rate of smoking has been pushed down into poorer socioeconomic groups as well as people with serious mental illness.
It's an interesting correlation when you think about it, especially when you take a look at the cost of a pack of cigarettes today. They are not giving those things away, sir.
That's correct. Absolutely.
I mean, I guess they probably would give them away for a couple of months if they thought they could get away with it, because that would mean they'd get that many more people hooked. And it is a powerful, powerful addiction. That's also clearly understood. It is no longer a topic for debate, hasn't been for decades now. But quitting smoking can be one of the toughest things somebody manages to accomplish. Well, it's a powerful addiction, and some methods work better than others. It really is an individual sort of thing, isn't it?
Well, it's both an individual, but it's also social context will make a significant contribution to smoking in any given community. And just like with all behaviors, people are influenced by their peer group. They're influenced by their community. And so we do know that people who are around other people who smoke will have a greater likelihood of smoking. And of course, that's not true in every case. But in general, the social context will be a significant contributor to people continuing to smoke. People quitting, of course, conversely, are also influenced by those who are around them. And there are a wide variety of strategies that people use, both in the traditional, quitting smoking cessation, but also in the larger realm now of what's commonly referred to as harm reduction or tobacco harm reduction.
I was a smoker, sir. It took me several attempts. And in some of those instances, I had managed to quit, not just for a matter of hours or maybe a matter of days, but in one significant moment of weakness. It was after a period of literally years I had walked away from tobacco. And, it wasn't nearly as difficult to find myself hooked once again as I thought it would be. This is the sort of thing that you need to stay on top of.
Absolutely. Absolutely. The cravings that people have for nicotine generally begin to decrease, within a couple of months to maybe a year or more. But certainly in times of stress, people have a memory of something that they associated with very positively, even though they knew that behavior, in this case, smoking cigarettes or other tobacco products, was dangerous and harmful. The positive association is more compelling, and it brings us back to that addiction.
What about so-called non-tobacco products or these? We've seen this proliferation of e-cigarettes and vaporizer pens and that sort of thing. But the nicotine is still there.
Absolutely. And of course, nicotine is, as you stated earlier in this interaction, is a very compelling and addicting substance. But we also know that for most people, that the sensory motor or the hand-to-mouth aspect of the behavior is important to people. Smoking becomes very ritualized in addition to the pharmacological property of nicotine. Hence, the appeal, I believe, of a lot of electronic devices satisfies that hand-to-mouth kind of behavior. We certainly have, long before electronic cigarettes, we have other what's commonly referred to as nicotine replacement products like the patch, the gum, lozenges. These are substances that people apply or chew or suck on, which essentially allow them to take in the nicotine, and it can do an incredibly good job in satisfying that craving and that need. But it doesn't satisfy for a lot of people the hand-to-mouth. So I believe that's been part of the satisfaction or the appeal of electronic cigarettes.
So here in Maine, we are fortunate in that there are resources made available for folks by way of a website called tobaccofreemaine.org. There's even a Maine tobacco helpline. It's a toll-free number that people can utilize, 1-800-207-1230. There's no shame, there's no weakness in recognizing that this is a significant challenge, and asking for help is exactly the right course of action, isn't it?
Absolutely, absolutely. I mean, a lot of people are able to, as we say, do it on their own, go cold turkey, and in fact are successful. But a lot of people also need help, either some kind of aid in the way of nicotine replacement products, some kind of quit line, some ongoing group. As you might be aware, there are also medications that essentially help to address the craving. There are electronic devices. There is snus, chewing tobacco. All of these efforts can go a long way in helping people either reduce or totally eliminate tobacco from their lives.
And sir, you mentioned medications. It is important to note that many of the medications that are available right now are certainly effective, but that's the sort of thing that you need the assistance of a qualified medical professional. You can ask your primary care physician about those types of medications to find out what might work best for you.
Absolutely.
Hey, well, listen, we really appreciate your time this morning, Kevin. Thanks for helping us remind people about this great annual event. The Great American Smokeout is a tremendous way to promote public health, public well-being. We're going to share a link on our Facebook page that'll get people to all of the information they need to start down the road to a tobacco-free life. We appreciate the work that you continue to do as a public health professional in assisting people in kicking this, quite literally, this deadly habit. Thank you, Kevin.
Absolutely. Thank you.